Soldiers from Blanchfield Army Community Hospital recently joined their counterparts from the Fort Campbell-based 586th Field Hospital for a training exercise aimed at readiness.
The focus of this FTX is to get after our clinical tasks for the 68 Whiskeys, the 68 Charlies, and integrate some of our medical augmentees that work at Blanchfield Army Community Hospital.
Whiskeys and Charlies are medics and enlisted nurses. O'Connor planned a mass casualty drill complete with realistic-looking wounds to test the first responders' ability to treat and evaluate casualties and triage patients to the appropriate level of care, ultimately encompassing each section of the field hospital.
The EMT section, the emergency section, it gets a lot of the glory, especially up front, and the gore. It's a very hectic environment. But as soon as it, is triggered that they're receiving patients, all of the other sections, they send a representative, a surgeon, and a nurse. Radiology sends their technician, lab sends their technician, so that, the help that you need, it's immediately available. The wards, they begin preparing to receive patients. The ORs start opening sets, because they can open up the general surgery sets and adjust fire because some of the patients will need to go directly to surgery.
The realistic training provided less experienced soldiers an opportunity to get familiar with the field hospital in a controlled environment.
I wasn't expecting it to be so chaotic, but then once the initial takeoff happened and everyone found where they were supposed to be, which was pretty instantaneous, it went through pretty smoothly. So you could see the PAs and the doctors and everybody running through, and all the nurses making sure that everybody had the right medications, everybody had the right interventions. And once they did, the medics really did what they needed to do. It was great.
Only members of the training team knew what would unfold.
We developed the scenarios for the patients, like as I said, that will test those things. And so the scenarios will, key the doctors and nurses here as to what's happening to the patient, which should trigger a reaction, as in, ordering a certain CT, ordering blood products, or needing immediate surgery, or someone that can be delayed. All of those types of things go into creating the scenarios.
O'Connor and observer controllers graded response capabilities during the drill and provided feedback to leadership, which can be incorporated into future exercises to build on the unit's capabilities and the integration of the Blanchfield staff.
So I think it's phenomenal, actually. We set up, everything looks well and is connected appropriately, and then with the organic staff, and then incorporating and integrating the Blanchfield providers, it's just been great. Everybody's motivated, and we're really making an impact.
For Blanchfield Army Community Hospital, Fort Campbell, Kentucky, I'm Maria Yeager.